Good day, Ma'am Sabas, and to my fellow groupmates. I am Hanami Jongay, a student nurse from BSN 1T. And today I am going to demonstrate the proper way of assessing the neurologic system. But before that, let me define the assessment of the neurologic system and cite its purpose. So, a neurologic examination is the assessment of sensory neuron and motor responses, especially reflexes, to determine whether the nervous system is impaired. This typically includes a physical examination and a review of the patient's medical history, but not deeper investigations such as neuroimaging. And its purpose is to evaluate one or more aspects of nervous system functioning. They help confirm or rule out disorders affecting your brain, nerves, and spinal cords. Good morning, ma'am. I am Hanami Jongay, and I am one of the nurses from Southern Luzon State University. And today I am going to assess your neurologic system, and in doing that, it will help the nurses as well as the attending physician to determine if there is any underlying problems or abnormalities that occur in your neurologic system. And now we will be proceeding in the actual procedure of the assessment of the neurologic system. So now first is I will going to test the CN1 or the olfactory. With eyes closed, occlude one nostril and identify a scented object that I am holding, such as soap, coffee, or vanilla. And I will repeat the procedure for the other nostrils. So now, ma'am, I am going to ask you to smell something that I am going to make you smell. And then you will first close your eyes. And you will occlude the other part of your nostril while we are going to use the smell on your other nostril, okay? So now we are going to proceed. Close your eyes. Occlude your other nostril, okay? Okay, what do you smell? Okay, the other one. What do you smell? So now for the CN2 or the optic, I will ask the client to read a newspaper or a magazine paragraph to assess near vision. Okay, so now, ma'am, I am going to make you read, or I will present a paragraph that you will be reading, and I want you to read this part. Okay.
Observe feet for base, weight bearing, stability, hip position, stride, arm swing, and posture.
Okay, thank you. And then, I am going to assess the CN3 or the oculomotor, the CN4 or the trochlear, and the CN6 or the abducens, and I will inspect the margins of the eyelids of each eye. So now, mama, I am going to inspect and measure the eyelids of your each eye, okay? So, I am going to proceed now, ma'am. Okay, I'm going to start now. Okay. And now, I am going to assess the CN5 or the trigeminal nerves to test for motor function, and I will ask the client to clench the teeth while I am going to palpate the temporal and the masseter muscles for the contraction. Okay na, mama. For the next procedure, I am going to palpate your temporal and also the masseter muscle, and I'm going to ask you to clench your teeth, okay? Okay, I'm now going to palpate your temporal. Okay, clench your teeth, ma'am. Another one. Okay, and now we're going to the masseter. Okay, now clench your teeth, ma'am. Okay, one more. Okay. So now I am going to test the sensory function with that vary the sharp and the stimulus in the facial areas and compare sides. I will repeat the test for light touch with the wisp of cotton. So what we are going to do, ma'am, is I will use a bobby pin to touch your forehead, your cheeks, and your chin. And I am going to ask you to close your eyes while I'm doing it, and you will tell me if where is the location of the bobby pin. Okay, is it in your forehead or in your cheeks or in your chin? Okay, so now close your eyes, ma'am.
Left cheek. Right cheek. Forehead. Chin.
Okay, so now I am going to use a cotton wisp, and I will also do the what I've done earlier. Okay, so I want you to close your eyes. I will proceed now.
Chin. Left cheek. Right cheek. Forehead.
Okay. And now I will test for the corneal reflex, and I will ask the client to look away and up while I will lightly touch the cornea with a fine wisp of cotton. And I will repeat on the other side. So now, ma'am, what I am going to do is you will look away in an object behind me, and while I am touching slightly your cornea with a wisp of cotton, okay? So I will do it both in your eyes, okay? I will start now, ma'am. Look on the other side. Okay, the other one. Okay, can you look up? Okay, another one, look up. Okay. And now, I am going to test for the cranial nerve number 7 or the facial. I will test the motor function, and I will ask the client to smile, to frown and wrinkle forehead, to show her teeth, to puff out cheeks, to purse lips, and to raise eyebrows, and as well as to close eyes tightly against the resistant. Okay now, ma'am, so I am going to test your motor function, and you will just do what I am instruct you to do, okay? So now, ma'am, smile. Okay, can you frown and wrinkle forehead? Okay, can you show your teeth? Can you puff out your cheeks? Okay, can you purse your lips? Okay, can you raise your eyebrows, ma'am? Okay, and can you close your eyes tightly within the resistance? Okay, thank you. So now I am going to test the cranial nerve number 11 or the spinal accessory. So I am going to ask the client to shrug her shoulders against the resistance to assess the trapezius muscle. Okay, now ma'am, what we are going to do is you will shrug your shoulder with a resistance, and we will do it multiple times, okay? So I'm going to touch your arm. Is it okay with you? Okay. Now shrug your shoulder. Okay. One more time. Okay, last one. Okay. So now I am going to proceed in asking the client to turn her head against the resistance, and first to the right, then to the left, and to assess the sternocleidomastoid muscle of the patient. So now what I am going to do is I will put my hand in here to serve as a resistance, and while my hand is in this part of your head, you will turn your head to where my hands are, okay? Okay, so now let's do this. Okay, and the other one. Okay. So now I am going to assess the motor and cerebellar systems. So I am going to assess the rapid alternating movements, and I will have the client to sit down first, and first ask the client to touch each finger to the thumb and to increase the speed as the client progresses. And I'll repeat with the other side, okay? So now, ma'am, I want you to do this. Look at my hands. I want you to do this, okay? And I want you to speed, to have a speed upon doing it multiple times. Okay, now, ma'am, for the right one. Okay, now proceed. Okay, fast. Okay. Okay, for the left hand. Okay. Faster. Okay. So now, I am going to ask the client to put the palms of both hands down on both legs, then turn the palms up and turn the palms down again, and ask the client to increase the speed while doing it, okay? So, now, ma'am, what we are going to do is we will do the supination and the pronation, okay? And then you will put your hands on your thighs, and then you will move your hands up and down, okay? Okay, and you will faster upon the procedure, okay? Okay, now let's proceed. Okay. Okay, thank you. And then now, I am going to proceed in assessing the sensory system. So I will test the light touch sensation using a wisp of cotton to touch the client. Okay, so now, ma'am, I will touch any part of your body or the upper extremities, and with a wisp of cotton, and you will tell me if where is the location of the wisp of cotton, okay? Okay, now, ma'am, close your eyes. Okay, so now I am going to test the pain sensation of the client, and I will use the blunt and sharp ends of a safety pin or a paper clip. So now, ma'am, I am going to test your pain sensation. I will use a bobby pin or a safety pin or a paper clip to test it, and I will just ask you if it's painful or not. You will just answer me if it's not, or is it painful. Okay, I will start now. Is it painful? Okay. Is it painful? Okay. Is it painful? Is it painful? Okay. So now, I am going to test the sensitivity to position. I will ask the client to close both of her eyes, and then hold the client's toe or finger on the lateral side and move it up or down, and then I will ask the client to tell the direction that it is moved, okay? And then repeat to the other side. Okay, now, mama, what I'm going to do now is I will test the sensitivity of your hands. You will close your eyes, and then I will move your fingers, one of your fingers to down or up or left or forward or right, okay? And you will just tell me where is the location of your finger, okay? And now, close your eyes.
Upward. Upward. Left side. Right side. Downward. Forward.
Okay, for the next part. Right. Next part.
Upward. Left side. Forward. Right side. Okay.
And now, I am going to assess the tactile discrimination or the fine touch of the client. So remember that the client should have their eyes closed, and then test the stereognosis of the client by placing a familiar object such as a quarter, a paperclip, or key in the client's hand, and then ask the client to identify it and repeat with the other side of the hand. Okay? So now, ma'am, what we are going to do is you will close your eyes, and after you close your eyes, I will put a familiar object in your hands, and you will close your fist, and then afterwards you will identify what is the object that I put in your hands. Okay? So now let's proceed. Close your eyes, ma'am. Let me hold your hand, and then close your fist. Okay, now what is it?
Roll of tape.
Okay, that's good. Okay, for the other one. Okay, what is it?
Cutter.
Okay, that's right. So now I am going to test for point localization, and I will briefly touch the client and ask the client to identify the points touched. Okay? So, ma'am, what I am going to do is I will touch you in some part of your upper extremities, and you will identify it for me. Okay? You will tell me if where is the location that I touch you. Okay? So now, ma'am, close your eyes.
Touch siya, hindi ba bipin?
So now, ma'am, close your eyes. Okay.
Left arm. Right shoulder. Left lower arm. Left shoulder.
Okay, that's great. And then now, I am going to test the graphetia, and I am going to use a blunt instrument to write a number such as 2, 3, or 5 on the palm of the client's hand. And then I will ask the client to identify the number, and then I will repeat it with the other number on the other hand. Okay? So now, mama, what I'm going to do is I will instruct you to close your eyes. So now, mama, what I am going to do is I will instruct you to close your eyes, and then I will make your palms to in position like this, and then I will write any number or any word that or any letter that and then afterwards you will identify is what letter or what word that I wrote on your palm. Okay? So now let's proceed. Close your eyes, ma'am. Okay. Okay. Other one. Okay, that's right. And now we will be proceeding to test the extinction. I simultaneously touch the client in the same area on both sides of the body at the same point, and ask the client to identify the area that has been touched. Okay, now, ma'am, so what I'm going to do is I will touch you in a specific area of your body, and then you will identify it. Identify it where is the location of the part of your body that I've touched. Okay? So now, ma'am, close your eyes. Okay? Okay, now, ma'am, open your eyes. Where is the location of what I've touched? Okay, that's right. And now, we are done with the neurologic assessment, system assessment. And so far, all in all, it is all good. And I don't see any abnormalities in your neurologic system. And I am so grateful to you, and I am so thankful that you cooperated well in the assessment of your neurologic system. Now, ma'am, you can rest well and have the whole day with you. And then I am just going to document everything that I've observed or I've assessed in your neurologic system. And rest assured that it will be given to the attending physician for further diagnosis, okay? And I will be back tomorrow to inform you what is the diagnosis of the attending physician. And then now, I am going to proceed now, ma'am, and you may rest now, okay? Thank you so much.
Thank